Hello, I'm Dr. Oni Blackstock. I am a primary care and HIV physician based in Harlem, New York City, and I'm also founder and executive director of Health Justice, which is a racial and health equity consulting firm that supports healthcare and public health organizations to center anti-racism and equity in their internal work as well as their external work. And I am pleased to be here. I was inspired to go into medicine by my mother, the original Dr. Blackstock, Dr. Dale Blackstock, who had a very different upbringing than I did. She was raised on welfare by a single mom along with her 5 other siblings. Did not have a lot of support, but studied really hard and found a wonderful mentor and a college professor who urged her to go to medical school. And as my twin sister and I were growing up, she often took us to many of the community health fairs that she hosted along with other Black doctors. She took us to the clinic in the hospital where she worked, so we basically grew up in that setting. And so I kind of had no other choice but to pursue medicine as a career.
Doctor, let's talk about HIV stigma. Is there still a stigma? How has that stigma changed? Why is it still here? Can you speak about it?
Sure. Yeah. So we're now 40 years into the HIV epidemic, and even though we've had substantial advances in terms of HIV treatment, HIV prevention, stigma is the one sort of barrier in many ways that persists and makes it really challenging to really put an end to the epidemic. So even though HIV is now, we think of it as a chronic disease like diabetes or high blood pressure, it's still exceptional in that people, have a lot of fear around it, have a lot of shame around it as well. And so a lot of the work that I do is providing education around HIV because there's a lot of misinformation that's still out there in terms of how you contract HIV. You cannot contract HIV by kissing someone, by spitting on someone, by biting someone. And we know sort of the main modes of transmission are primarily via sexual contact or injection drug use nowadays.
What resources are out there now that people can use to really take advantage of preventative HIV healthcare?
Yeah, so I think what's really great is that we have a new sort of newish strategy called PrEP, pre-exposure prophylaxis, which can be taken as a pill or an injectable that allows people who are HIV negative to stay HIV negative. And it's really important for healthcare providers to sort of know how to have conversations with their patients around sexual health. There's a wonderful initiative from ViiV Healthcare called Risk to Reasons that's focused on HIV prevention and care among Black, cisgender, and transgender women. And this is really about getting healthcare providers comfortable with engaging women in discussions about their sexual health and figuring out what are their reasons for HIV prevention. Could it be that they want to feel empowered? Is it that they want greater intimacy in their relationships? Is it sort of about self-care? So we are sort of helping to provide healthcare providers with tools to have these conversations with their patients. I also want to put a plug in as a CDC HIV ambassador for 2 resources, one called Let's Stop HIV Together, and that's for the general public, and lots of great resources around HIV prevention and treatment. And then for healthcare providers, there's HIV Nexus, so just Google those terms.
Yes. So the name that you just brought up, Let's Stop HIV Together. How can we do that? How can we be a part of that?
Right. So it takes it's a collective effort. Healthcare providers can't do it alone. People living with HIV can do it alone. Those who may be who may benefit from HIV prevention can't do it alone. So it's really just talking about our interconnectedness and the ways in which it will take collective action in terms of collective education. Again, addressing issues around stigma, knowing what HIV prevention strategies are out there. So we have, as a healthcare provider, I am out there talking about these issues. I have colleagues who are living with HIV or on PrEP who are also spreading the word. So it's just saying that, as a collective, we sort of need to get together to really work to end the epidemic.
Wow, everybody can do their part.
Yes.
Okay, last question. You are an incredible Black female physician. and those watching may be younger and thinking about being in your shoes later on in life, what would you tell that person?
Yes, well, I think I would say, you can be anything you put your mind to. If you see somebody who is doing something that inspires you, that motivates you, and you're able to reach out to them, I would encourage you to do that, to learn about what their path has been. Their path may be different from your own, but there may be some lessons or best practices that you might be able to learn from them. And then also to say that don't be discouraged, along the way, because there are going to be obstacles, there are going to be barriers. Things are not always easy, but if you walk in your mission and your purpose, you will achieve the goals that you have for yourself.
All right, awesome. Well, you heard it here first from Dr. Blackstock. Thank you so much for joining us, and thank everybody for watching us at the National Medical Association 2023 conference.